Hi, Dr. Clement. Thank you for joining me today. First off, to start off, would you like to introduce yourself and what you do?
Yeah. So, my name is Jinsey Clement. I am a hematologist and an oncologist. I work at the Emmanuel Cancer Center here in Turlock. And I see patients with blood disorders and cancer.
Okay, thank you. And now, would you like to establish a little bit of background on oncology and hematology and what that is?
Yeah. So, oncology is a branch of medicine that focuses on diagnosis, treatment, and prevention of cancer. Cancer is not just one disease, there are many subtypes and they all behave differently. Modern oncology has evolved tremendously, and now we use different kind of medications, clinical trials, precision medicine to effectively take care of somebody's cancer with more personalized, from a personalized standpoint. Hematology focuses on diseases of blood and blood forming organs such as bone marrow, spleen, and lymph nodes. It could be benign conditions such as anemia or clotting disorders, or blood cancers such as leukemia, lymphoma, and multiple myeloma.
Okay, thank you for establishing that. So, would you say that there are cancers that are becoming more common within youth or just in general today? And if so, are there any early warning signs that people should look out for just to be safe?
Yes, unfortunately, we are seeing certain cancers, especially colorectal cancer, becoming more common in younger adults than we used to. We are still trying to understand fully why, but factors like diet, obesity, processed food, lack of exercise, stress, environmental exposures, and changes in gut health may play a vital role. This is why paying attention to the symptoms and not ignoring changes in your body is very important, even at a young age. People often ignore symptoms because they assume they are too young to get cancer. Persistent fatigue, unexplained weight loss, blood in stool, prolonged pain, unusual lumps, any of these things you should bring your attention to your regular doctor and should not be ignored. Most symptoms do not end up being cancer, but getting checked early can make a major difference.
Yeah, thank you. I think that's very important for especially a lot of the younger people to hear. How would what would you say? How important are regular checkups for and screenings even for younger people? How is that important, and what impact does it make?
Yeah. So, prevention is better than cure. I believe in that very strongly. Even when someone feels healthy, screenings and routine visits help identify problems before they become more serious. Young people may not need every cancer screening yet, but building healthy habits with preventive care early creates a long-term benefits. And I had briefly touched about, so biggest risk factors are avoiding smoking, vaping, limiting alcohol, and maintaining a healthy weight. Exercise and sleep are very important along with balanced diet. Also protecting skin from sun exposure. Another important thing that I always want to bring to my patients, even younger patients, are staying up to date on vaccines like HPV and hepatitis B. Many of these small, consistent habits over time matter more than extreme short term changes.
Yeah, so tying into the importance of that, would you say that communities emphasize, or doctors in general, would you say that it's emphasized and the importance of getting checked up and keeping yourself healthy is emphasized enough?
Yeah, so I think when everybody believes that youth and young adults don't get sick, don't get these diseases, yes, the importance of these screenings and all the education kind of goes down. What I've heard and seen over the course of my clinical experience is that many times I hear stories that symptoms are dismissed either by self or by families or even healthcare in the healthcare world. So absolutely, education is so important, and I think we need to have more of these educational series and talks to help promote cancer screenings and emphasis on education and how to bring up and how to, take care of yourself. And I believe these kind of educational series are going to be very important to help reach that goal. Absolutely.
Yeah, and connecting that back to the doctors themselves and understanding a patient. Do you think that family history plays a significant role in this aspect?
Yes, absolutely. Anybody who has a family history of certain cancers, especially breast cancer, ovarian, colon, there is there are these cancers that are tied with family history, and it is very important to bring that to your physician and get the appropriate genetic testing. Especially these are simple blood tests that is available very widely these days. And we get to know about any genetic changes, especially for breast cancer. BRCA1 and 2 mutation plays an important part, a role in knowing if a patient is going to get future breast cancer or ovarian cancer. It can save major life changing matters over the course of time if we take appropriate measures by knowing these. So, super important to bring this up to your physicians.
Yeah, and I find that very interesting. So, what misconceptions do teenagers usually have about cancer?
Yeah. So, the first things they think is only cancer affects older population. Okay. Other one is that cancer means death sentence. While cancer can certainly be serious, treatments have improved dramatically over the years. Modern oncology focuses on personalized, less invasive, and highly effective care that has significantly increased survival rates. Another misconception is that cancer is contagious, which is not true. People are also scared of doing invasive procedures like biopsies or surgery, thinking that that may lead to cancer spread. In reality, these procedures are important in accurate diagnosis and treatment planning. So, we have to always educate everybody against these misconceptions so we can always plan and treat the patient the right way.
Yeah, and would you say that there are many resources that teenagers can access to understand cancer better?
Yeah, community organizations are incredibly important at this juncture. Many provide emotional support, transportation assistance, financial guidance, educational programs, survivorship resources, and support groups at no cost. Organizations like American Cancer Society, Leukemia Lymphoma Society, and Cancer Support Community help reduce isolation and connect patients together with very meaningful resources. Many offer 24/7 hotlines, support groups, transportation services, and educational workshops. These are very important when a patient or a patient's family is going through cancer diagnosis and treatment. In addition, local hospitals and local voluntary organizations also do have help that is available to young adults and even elderly patients. So, important to reach out to all the support you have, especially friends and family, and look for all these resources.
Yeah, I think that's very important for the youth to hear. Um, and expanding on that topic, why do you think some people avoid going to the doctor even when something feels wrong?
Cancer diagnosis can bring intense fear, anxiety, depression, uncertainty, and even stigma. Fear is a major reason I believe that the patients don't want to get to their doctors. They're afraid of being hearing bad news and at the same time worry about cost, judgment, and also not being taken seriously. And in some communities, there are also maybe some mistrust in the healthcare system. Delaying often comes from anxiety, not irresponsibility, which is why compassionate communication matters so much in this field.
Yeah, and in regards to compassion, why would you say relationships with patients is extremely important, especially as a doctor in such an important field?
Like I mentioned, cancer diagnosis brings intense fear and anxiety. And in addition to having the expertise to treat them, caring for a patient with a lot of compassion and empathy is super important. Emotional support can improve coping, treatment adherence, communication, and quality of life. Patient needs to know that they are not facing this journey alone. And my daily clinic experience, I care for patients and I support them as one of my family member. Many times you have to sit down, hold their hand, and sometimes give them a shoulder to cry on. And sometimes that helps them know that you care, your nurse cares, your team cares. And then, even if a patient is overcome with fear, when they know that they have a team of people behind them, they are able to move forward, possibly one step at a time. And hence, I believe so much in compassionate care in helping patients navigate through these vulnerable, most difficult times of their lives.
Yeah, now going a little bit into mental health in its relation to cancer, how does a cancer diagnosis affect someone mentally and emotionally?
Yeah, I think it again goes back to the fear and anxiety. It all stems from there. These emotional challenge, can directly affect their treatment adherence. I have some patients, they are highly anxious and can't come to their appointment. They miss their appointment. Sometimes you have to stop and tell them, please come in, please talk to us. And being depressed and overwhelmed will not help them. So there are times that we may have to have extra team, extra support with our social work team to help patient go through the mental health issues. Sometimes it could be starting maybe some medications that can help the overall mood. Sometimes helping them take care of their families. Support may also come from their friends, family, therapies, support groups, and also spiritual communities are also very important sometimes in their well being. Mental health scenarios and situations are very underestimated, but addressing them from the very first meeting with the physician and checking with them periodically and helping them cope throughout the process is how you're going to help them. And even very small acts of compassion can have a profound impact on patients' lives.
Yeah, and thank you for going into the emotional aspects of that. I think that's very important for everybody to hear. And now, in terms of health equity, how does access to healthcare affect cancer outcomes?
So, access to healthcare can dramatically, affect cancer outcome. People without insurance, transportation, or access to nearby specialists, or even financial stability may delay their screenings or treatment. Early detection often leads to better outcomes. So, barriers to care can unfortunately lead to more advanced disease at diagnosis. And common barriers includes, financial limitations, limited healthcare facilities, and also cultural situation like fear, misinformation, and distrust in the healthcare system could also be barriers, often that are often interconnected, especially if a patient is from a poor educational background. That can also definitely be, cause some barrier to care as well.
Yeah, and I think that's important in terms of support for everyone to hear that there is support available. But now, what changes would make healthcare more equitable for everybody?
So I think first is improving affordability, also is expanding preventive care, as well as increasing access in underserved communities, offering healthcare education, and having more screening information. All of that is going to improve healthcare. Also, along with the education that we talk about, building trust between the healthcare providers and communities also would make a major difference. Equity means everyone has a fair opportunity to receive quality care.
Yeah, and now going more specific into the youth and their place within these issues, what role can young people play in improving health equity?
Young people can advocate for awareness, educate themselves about public health issues, as well as volunteer in the communities. They could also support inclusive conversations and help reduce stigma around the healthcare and mental health. Future change often begins with younger generation speaking up. So, very important for youth to advocate in all these avenues.
Yeah, I do think youth play a pretty big role in terms of this aspect, in terms of advocating and serving as a way to volunteer or place some insight. But in terms of long term health and the teen lifestyle, how dangerous can chronic stress become if it starts young?
Chronic stress affects both mental and physical health. Over time, it can contribute to sleep problems, anxiety, depression, high blood pressure, weakened immunity, and unhealthy coping habits. Learning healthy stress management early in time is incredibly important.
Yeah, I think that's very important for many young people to hear, especially high schoolers. Um, with their very busy lives, I think everybody should prioritize keeping themselves healthy. But in terms of what they consume on an everyday basis, would you say that energy drinks, vaping, and poor sleep can create long term risks for teenagers?
Absolutely, I think so. Vaping can damage lung health and expose young people to addictive nicotine. Poor sleep affects concentration, mental health, metabolism, and immune function. Excessive energy drink use can strain their heart and worsen anxiety and sleep problems. These habits may seem temporary, but can have long lasting effects on your health.
Yeah, I think that's very important for youth to hear as well. Um, in terms of social media, what impact would you say that it has, social media, on body image and mental health?
Social media can create unrealistic comparisons and pressure to appear perfect. Constant comparison can negatively affect self esteem, body image, and anxiety levels, especially in teenagers whose identities are still developing. So, balance and healthy boundaries are so important during this young age.
Yeah, and what small daily habits actually make the biggest difference over time?
I would say the most important would be consistent sleep. Then comes exercise, healthy eating, staying hydrated, limiting harmful substances, for example, alcohol and smoking if that's the case, managing stress, and also maintaining a very supportive relationships. All of these makes big difference. So small healthy choices repeated over years have a powerful cumulative effect. And these small habits will stay with you forever.
Yeah, and going into realistically healthy lifestyles, how would you say a healthy lifestyle actually looks for busy teenagers?
So, healthy lifestyle does not mean perfection, it means balance. So, getting adequate sleep most nights, staying active, eating reasonably balanced meals, taking breaks from screens. We are all kind of stuck to the screens many times. That itself can help long term. Managing stress and also know when to ask for help, even if it's a small situation. Ask for help when you need. You have a community, you have your friends, you have your family. Whenever you needs are there and they're realistic, ask for help and then make these small healthy lifestyle changes.
Yeah, I think all that information is super important for teenagers to hear, especially nowadays. But going into you and your job as a doctor, um, what inspired you to go into oncology and hematology?
So, as a resident physician while training, when I was rotating through my inpatient oncology rotations, is when I realized first that this may be the career choice that I would like to make. Most of the time, it was a comment from a patient or a nursing staff mentioning that I was able to help them or their family member through their worst vulnerable situation. We all physicians are well versed, well studied, but many times taking that extra time to spend with your family member or a patient goes a long way. And that creates very meaningful relationships. And that is something that I have felt very important in my career choice as a hematology oncology physician. Helping someone feel supported, seeing patients recover, or simply being there during the difficult moments are very rewarding. And even small victories matters, especially when it comes to cancer situation.
Yeah, and going back to the students, what advice would you give to students that are interested in healthcare careers?
So, healthcare is not only about science and grades, that's equally important, but communication, empathy, teamwork, and resilience are just as important. Try to gain real experiences through volunteering, shadowing, community involvement. Also, staying very curious, compassionate, and open minded. I believe these are very important, and also having the patience to go through the years that you're to put into to become a healthcare professional.
Yeah, and to close off everything, all the information that we've gone through today, if every teenager could remember one thing about their health, what would you want it to be?
So your health is built through small daily choices over time. Taking care of yourself early matters more than most people realize, and asking for help is a sign of strength and not weakness.
Yeah, thank you. And finally, what gives you hope for the future of healthcare?
So, medicine has advanced over the years, and advances in medicine, early detection, and very personalized treatments, as well as growing awareness about mental health and prevention, all of that gives me hope. Younger generations are also becoming more open to discussing health and wellness, which is very encouraging.
Okay. Thank you for all of the information that you shared. I think it's very insightful and everything that you do is very inspiring. So, thank you for joining me today and spreading your insight about health equity and what you do.
Thank you so much. It is truly a pleasure to be here.
Thank you.